Reserving the right to object, Obamacare has failed because it is a classic example of big government getting in cahoots with a healthcare industry that's broken. It was doomed to fail because when has big government and big business ever resulted in something that's going to cost less and be more effective? Under Obamacare, decisions are made by the healthcare industry executives and the federal government bureaucrats, not patients, not consumers. This program is authorizing millions of dollars we don't have to prop up a system that's not working. If Obamacare was working, it would sell itself. But it doesn't work, costs continue to rise, and Americans continue to be stuck with the bill. I believe there are things that Obamacare does that we should keep. Actually incorporated it into my own business's plan back before the law required you to do it. I covered pre-existing conditions and no cap on coverage. The pillars of Obamacare, we should all accept that. And when they added keeping kids on there until they're 26, that's fine too. Those ships have sailed. But the Affordable Care Act is not remotely affordable, and it's only going to get worse. I applaud the Trump administration for doing their due diligence on how health care policy changes are going to affect average Americans. And they're taking the approach to not go deeper in the hole with something like Obamacare, but to reform the industry by making it competitive, transparent, eliminate the barriers to entry, and yes, encourage the health care consumer to get involved in his or her own well-being. And I do believe President Trump is right. The Republicans can be the party of health care without involving more government. But we need to do that by putting more power back into the hands of the American people, not ceding total power to government bureaucrats and big healthcare executives. I've got a better idea. Truth in Pricing Act. My bill, I'm countering with, encapsulates some of the ideas behind the proposed and final rules announced by the White House last week, which I fully support. The complex, opaque nature of healthcare pricing makes it difficult for consumers to anticipate, measure, compare healthcare costs and coverage options. Hospitals have a charge master that nobody can understand, which actually inflates retail prices billable to a patient or an insurance provider, but insurers usually negotiate steep discounts to these inflated prices that consumers and the employers who pay all the bills never see any of that. It's done behind closed doors. More pricing transparency would address this market failure. Increase competition, give more decision-making to the people that are supposed to use it. This is why I introduced the Truth in Pricing Act, which requires health insurers to disclose negotiated rates, including any cost-sharing obligations for consumers for health care services covered under their health plans. It is difficult for insured consumers to shop for health care services in our current opaque and broken market within which Obamacare works, especially if they don't know actual prices. And insurers have the unique ability to provide this information to consumers. Why subsidize insurance companies to pay for navigators and insurance agents when we can instead make the market work better and be more consumer-driven and transparent? This is the way we break the stranglehold that government and big healthcare has on healthcare delivery. I ask unanimous consent that the senator modify her request and instead, as if in legislative session, the Committee on Health be discharged from further consideration of Senate Bill 913, the True Price Act, and the Senate proceed to its immediate consideration. I ask unanimous consent that the bill be considered, read a third time, and passed, and that the motion to reconsider be considered made and laid upon the table.